Where You Make Me Feel by MJ. Okay, it's 9:43 in the morning. I'm in conversation with Mufazzal Lakdawala. The doc is founder, Center for Obesity and Diabetes Surgery. Questions already. Priyanka says, how fat is too fat to get under the knife? Are there telltale signs, Muffi?
There are no telltale signs, but there are clear-cut guidelines, and we've come out with the ACMOMS guidelines, which are the Asian guidelines. So what the world agrees is that the Asians are fatter than what they are. Okay, so we've dropped the BMI points. So an average BMI of above 23.5 in an Asian context that means you're overweight. 23.5 to 27.5 is overweight. 27.5 above, that means you're already in the obese category. Then it ranges from grade 1, grade 2, and eventually if you're 37.5 and BMI above, then you're grade 3 obesity or morbid obesity. So anyone with a BMI of more than 32.5 with diabetes or with one of the host of problems like sleep apnea, infertility or gallstones is probably a candidate for surgery. Anything above 37.5 is again a candidate for surgery without any of these host of problems. But this, I want to say this is that this is not a cosmetic surgery. So this is definitely not. I refuse more patients than I actually eventually end up operating. Though I operate 5 or 6 patients every single day for bariatric surgery, I actually refuse a host a lot more, because I have these girls who come in and say this is a quick fix. This is not the quick fix. This is basically an answer to kind of manage your set points. You know, when they are obese, you have a set point which somehow, even if you diet or exercise, doesn't make you lose that weight, but eventually when you readjust that set point, when you've lost that 30 or 40 or 50 kilos, it really helps you to then exercise, diet for the rest of your life and manage your weight. So this is like the caption for God's is a second chance at life. This is actually giving you a second chance at getting your weight in order, and please grab it and take whatever precautions you need to. So follow up with good nutrition. This is not a replacement for good nutrition and exercise. This is just an adjunct or help along with good nutrition and exercise.
Sriram Mahadevan, does medical insurance entertain this surgery, and what's the cost?
World over, yes. Not necessarily India, but like I said, the central government health scheme is now paying for it, so hopefully this is a step forward, and very soon we should get it covered. In select cases, the insurance companies have paid for it when they've gone to the consumer courts, and then they've eventually paid for it, but not yet. It ranges from around 3 lakhs above. That's the basic cost of this surgery, because the equipment cost is very expensive. The moment the government of India passes this as a life-saving surgery, maybe these costs will drop to half, because then the consumable goods will not be taxed as much as they are being taxed now, and everything would change.
Queeky says, listening to your show right now with Dr. Muffi, impressive. Well, I'm in no need of surgery. I just love all your shows. Thank you, darling. Hi, Nigel. Hello, Saurabh Turakia. Good morning, Mystical Musings. Glad you liked the Madonna and the MJ. Hey, Ali Pally, the Gypsy Girl, all you wonderful people. Keep the messages going on. I'm going to put up more pictures. It's Nickelback with Rockstar, and post the song, more conversation with Dr. Muffi.